Using your stationary oxygen concentrator. If you have a lung problem such as chronic obstructive pulmonary disease or COPD or pulmonary fibrosis, you might have low oxygen levels. If so, you may need oxygen therapy to help you breathe better and do the things you want and need to do. Oxygen therapy is given using special equipment. This animation tells you about using a stationary oxygen concentrator. A stationary oxygen concentrator is a machine that turns room air into oxygen. You breathe in the oxygen through a tube that connects from the machine to a device you wear in your nose or over your nose and mouth. A stationary concentrator is also called a home or standard oxygen concentrator. It stays in one place, but has wheels so it can be moved inside the home. It plugs into the wall and runs on electricity. The air we breathe contains just 21% oxygen. An oxygen concentrator absorbs oxygen from the air and creates a blend that is almost pure oxygen. If you have a condition that prevents you from getting enough oxygen from the air, you can use an oxygen concentrator to get extra or supplemental oxygen to bring your oxygen up to a normal level. Your prescriber will let you know when to use your oxygen and how much to use. Your stationary oxygen concentrator includes the machine and a device called a cannula that fits in your nostrils to deliver oxygen. The cannula connects to a length of tubing. The other end of the tube connects to a nozzle on your concentrator. Some concentrators have a plastic bottle called a humidifier. This holds distilled water to moisten the oxygen you inhale. Your concentrator has a filter to clean the air, a flow meter to measure the flow of oxygen, and controls to regulate it. There are alarms to indicate loss of power, poor oxygen flow, and other possible problems. To set up your stationary oxygen concentrator, plug it into an electrical outlet. Keep the machine a foot or two from the wall so air can circulate around it. Once you plug it in, you can turn the machine off and on with a button. Ask the company that provides your oxygen concentrator about a backup oxygen supply in case your power goes out. The amount of oxygen flowing from the concentrator can be adjusted. If you feel like you are not getting enough, let your healthcare provider know. Also, ask your provider about using a finger pulse oximeter to measure your oxygen levels. You may have a low flow or high flow concentrator. Low or normal flow delivers up to 5 liters of oxygen per minute. High flow delivers 6 to 10 liters per minute. To connect the tubing, place one end over the nozzle on the concentrator. Then, gently push up until the tube end is securely on the nozzle. The tubing must be connected securely enough to stay in place even if you move around. You may want to ask your caregiver for help. You can also contact your oxygen supplier with questions. If your nose and throat get dry when you use oxygen, you may want to ask your doctor about a humidifier. This bottle filled with distilled water attaches to the concentrator and moistens the oxygen you receive. It needs to be washed each week with warm soapy water and allowed to air dry. Your concentrator has a filter. It needs to be cleaned or replaced regularly according to the manufacturer's instructions. Ask your oxygen supplier how to service it, how often you should do this, as well as how to do it correctly. If you think oxygen is not flowing correctly, check the tubing for kinks and blockages. If you are moving around your home, check that the tubing is not stuck or caught in something causing a blockage. You can also put the cannula in water. If you see bubbles, oxygen is flowing. You can use foam to cushion the area behind your ears where the tubing goes for added comfort. Avoid using any petroleum-based products on your lips, nose, or face. Use water-based moisturizers only if your nose, lips, or skin gets dry. In case of problems, know who to contact at the company that supplies your oxygen. You may want to have more than one way to contact them. You may also contact your prescriber. Your stationary oxygen concentrator can help your lungs deliver the right amount of oxygen for the other organs in your body to work properly. Being familiar with your concentrator can make this